Hello, my name is Maria, and my presentation will be about reproductive health, access costs. For a brief history, reproductive health is defined as the physical, mental, and social aspects of topics related to reproductive system, function, and processes. Modern reproductive health started to take shape with the first reproductive health clinic in the United States in 1916, which was a Planned Parenthood center. In 1973, one of the most landmark cases surrounding reproductive freedom for women was Roe versus Wade. Typical access methods. Access to reproductive health has changed drastically over the past few years. The availability of healthcare has been facilitated by technology. With the investments in technology, patients are now able to obtain care at various locations and through different avenues. Such methods of access are doctor visits, video or telemedicine visits, phone visits, and app visits, usually for prescription services. Issues with lack of reproductive health. Population control. Without access and education surrounding reproduction, the population could grow to levels that cannot be sustained either economically or environmentally. Likewise, the reduction of population at an increased rate can have hardening effects on a country's economy. Not enough people could lead to the same lack of resources as overpopulation, but not enough people could provide goods and services. Increase in sexually transmitted infections. Through the education of how these conditions manifest, prevention methods, diagnosis tests, and possible treatment, people know what to expect. If this access and resources are denied, the likelihood of proliferation increases. Stigmas should be avoided to assist in their eradication through healthcare practices, which can only be achieved through educated decisions and the use of protective measures. Lastly, effects to other healthcare areas. Reproductive health is a large aspect of the majority of people's lives, old and young alike. From mental health to physical health, reproduction plays a role, whether desired or not. Insurance role. Coverage. Coverage is the most important aspect of the access to reproductive health. Medicaid is the payer most likely to cover reproductive health, with 75% in family planning. Treatments for infertility for men and women are not covered by most insurances. There are many advancements in the coverage for reproductive services and treatments, but there are still several limitations to what is covered and where. Out-of-pocket, copay, or insurance costs. Regardless of the service or care being provided, most insurances associate copay, out-of-pocket costs, or an co-insurance costs. In some areas, cost of care may be more expensive due to the hospital's personal affiliations, either religious or political, and the governing law of the state may also restrict reproductive health. Providers' role. Specialties that provide care in reproductive health. Reproductive health encompasses several health fields due to how the body is structured. Such areas would include urology, obstetrics and gynecology, dermatology, infectious disease, and psychology. Access to providers. Certain procedures and medications are more expensive and practiced by fewer providers for several reasons, both professional and personal. Another obstacle to access to providers is that there is a general shortage of them in rural areas where services tend to be most needed. Resolutions. Increase access to reproductive health at the national level to reduce overall costs. More access means a greater reduction in reproductive health issues. Create safe alternatives and increase educational programs to help reduce costs. Better education allows for more informed consumers and better judgment on when to seek skilled intervention. In conclusion, access to reproductive health creates a difference in the costs associated with healthcare. More education reduces harmful stigmas that create barriers in healthcare, and costs are lower when reproductive health is accessible from even before the beginning of new life. Thank you and have a wonderful day.